Today we have Miss Wells. She's a 28-year-old African-American female who presents to the clinic today complaining of shortness of breath and wheezing that started 2 days ago after being exposed to her cousin's cat. She states that the shortness of breath and wheezing has been lasting about 5 minutes. She's had approximately that same episode about every 4 hours or so, about 10 times in the last 2 days. She does have a non-productive cough, which she states gets worse when she lays flat, and her shortness of breath has woken her up at night about 2 times a night. She does take albuterol for known asthma. She states that it's been decreasing her symptoms, but not completely resolved. She feels that the albuterol has now been ineffective. Her symptoms have been interfering with her activities of daily living. She was diagnosed with asthma at 2 years old. Her last attack was at 16 that she was hospitalized, but has not been since, and she's never been intubated for asthma. Listening to her lungs, she has bilateral expiratory wheezes posterior in her lower lobes, bilateral muffled words, but with no crackles, and she's currently in no respiratory distress. She's awake, alert, oriented. She was able to speak with me. Her vital signs are stable. Blood pressure is 122/68, heart rate 78. O2 is 90%, 97% on room air, and her respirations are regular. She's got unlabored breathing, but her FEV1, FVC ratio is 80.56%. She denies any pulmonary care. She denies any peak flow meters or spirometry, and does not record any of her asthma attacks or her treatments. She does state that she's sedentary. She was a past smoker. She had smoked for about 5 to 6 years or so, but the last time was when she was 21, so 7 years ago. She denies any ETOH or illicit drug use and does not know of any environmental exposures. So really, with the evidence of her symptoms of, every 4 hours, having symptoms in the past 2 days, especially affecting her activity and her nighttime symptoms, as per the GINA guidelines for asthma, I would say she's got a mild to moderate acute exacerbation of her asthma, and her asthma at the moment is moderate to severe. So really, my goal for her is to control her symptoms and really to get her to identify precipitating factors for her asthma. So really, again, we probably use that step 4 or step 3 or 4 treatment for that moderate severe asthma. So we would give her a low dose ICS and LABA combination med like Dulera, 2 puffs BID as her controller medication, and that's per those GINA guidelines, as well as then have her use that SABA, her albuterol, for exacerbations. I would also like to reteach her and monitor her technique using her inhalers, as well as teaching her how to use a spacer as well. I certainly would like to teach her to identify factors that might be environmental exposures that might exacerbate her asthma, as well as get her an asthma action plan down, and have her recognize the signs of worsening asthma when she would need her rescue inhaler. I'd like her to keep an asthma log as well. I'd like her to follow up with us in about 2 to 7 days or so to evaluate the treatment and see how she's feeling. Eventually down the line, I would like her to maybe use a peak flow meter. I think that would be appropriate for her, as well as possibly some allergy testing to make sure that we'll see exactly what her triggers are, including pet dander. She should certainly increase her exercise, and as always, smoking cessation is important.